If you have neck pain after a car crash and you were told to just stretch it out, I need you to hear this before you do another stretch. Stretch your neck after being injured in a car accident may be actively worsening the injury that caused your pain in the first place. In this video, you're going to find out exactly why this is happening to your neck, what the real hidden injury is that most medical testing never looks for, and the 3-step plan that actually addresses the problem directly so you can move toward lasting recovery instead of temporary relief. Hi, I'm Dr. Jason Nutche. I'm a chiropractor in Philadelphia and northeastern Pennsylvania with over 2 decades of clinical experience treating complex spine, nerve, and soft tissue injuries. I focus on advanced diagnostic testing, especially for spinal ligament injuries and precision X-ray analysis, because too many people are told nothing is wrong when the real problem simply has not been measured. On this channel, I break down why chronic neck pain, back pain, and headaches persist, explain what imaging can and cannot show, and walk you through modern regenerative options so you can make informed decisions about your health. If you want clear explanations, real answers, and a better understanding of what is actually causing your pain and how the body can heal, subscribe to my channel. My goal is to give you clarity, confidence, and a smarter path forward. Now, to understand why stretching can be so harmful in this situation, we need to look at the anatomy of the spine. Your spine is supported by a complex network of 220 ligaments. These ligaments are the passive support structures that hold your vertebra, the bones in your spine, in proper alignment, and that control how much movement is allowed at each individual segment. They are fundamentally different from muscles, and that difference is the entire basis of this problem. Muscles are active contractile tissues that can tighten up after an injury, and when the muscle is generally the problem, targeted stretching can provide meaningful relief. Ligaments are passive stabilizing structures designed to remain taut and restrict excessive joint motion. And when they are damaged, stretching does not help them heal. It stresses them further and makes the problem significantly worse. So if you have been stretching and not getting better, this is where the disconnect often is. You are treating this like a muscle problem when it may really be a stability problem. When you are in a car crash, particularly in a whiplash type collision, the forces involved in that impact do not just strain your neck muscles. Those same forces can stretch, micro-tear, or partially rupture the ligaments of the neck and even your low back. And here's the critical piece that affects so many patients who come into my clinic with this history. Standard MRI imaging and basic X-rays are not designed to detect ligament damage or the spinal instability that results from it. A person can have a significant ligament injury, go to the emergency room after their crash, have imaging performed, and be told that everything looks completely normal on their tests. They leave that appointment without knowing that the actual support system of the cervical spine has been structurally compromised. And this is where many people get stuck, because they're told everything is normal, but their symptoms keep telling them something is not right. When stretching is recommended for neck pain after a car crash, the assumption is that the problem is tight and injured muscles. And in some cases, that is partially accurate. But when the underlying issue is damaged ligaments and spinal instability, stretching is not addressing a muscle problem. What it is actually doing is pulling on tissues that are already structurally compromised, increasing motion in spinal segments that are already moving too much, and adding mechanical stress to an already vulnerable system with every single repetition. So even if it feels like you are doing something helpful in the moment, you may actually be reinforcing the very problem that is keeping your neck from healing. Instead of protecting the injured tissue, you are repeatedly stressing it, which can keep you stuck in the same cycle of temporary relief followed by recurring pain. So, how do you know whether this applies to your situation? There are specific signs that your neck pain after a car crash may be coming from ligament instability rather than simple muscle tightness. As I go through these, see how many of these sound familiar to you. Now, this is not meant to diagnose your condition, but if these signs sound familiar, you should have your neck evaluated by a qualified healthcare provider such as a smart injury doctor like myself. Number 1, stretching provides only temporary relief at best, and the pain consistently returns within a short period of time after each session. Number 2, you notice a feeling of looseness, weakness, or instability in your neck, especially at the end range of motion or in the period immediately following the stretching. Number 3, you have had imaging performed and were told that everything looks normal, but your pain and symptoms have continued for weeks or months without real improvement. Number 4, your pain keeps cycling back despite everything you have tried, and you have a sense that you are not making any genuine forward progress toward recovery. Number 5, certain head movements, particularly those that take your neck toward its end range of motion in any direction, make your symptoms worse rather than better. If you are recognizing yourself in one or more of these, you are usually where patients start to realize that something deeper may have been missed. If any of those descriptions match what you have been experiencing, there is a strong likelihood that the real structural injury in your cervical spine has not yet been properly identified, and a muscle-focused approach is not going to resolve it. The solution to this problem begins with the right kind of testing, because you cannot build an accurate treatment plan based on findings you have never properly measured. And once you actually measure the problem correctly, the path forward becomes much clearer and much more straightforward. Most traditional care approaches for neck pain after a car crash do not include motion-based spinal testing, even though gold standard American Medical Association tests exist specifically for this purpose. One of the most advanced tools available for this type of assessment is called SpineCamp, developed by Medical Metrics. It is a very sophisticated test that is also very inexpensive compared to MRI and other advanced testing. SpineCamp uses objective motion analysis to measure actual vertebral movement at each spinal segment throughout the range of motion, and it identifies excessive or abnormal movement patterns that are the direct clinical indicators of ligament injury and spinal instability. The key distinction here is that this independent, objective biomechanical data, not a symptom questionnaire, not a provider's clinical impression, and not an assumption based on how the pain feels on a given day. This means you are no longer guessing, and you are no longer trying random treatments hoping something works. You are working from actual data. Standard MRI and basic X-rays miss this information entirely in most cases, because they are static images of a system that needs to be assessed in motion. SpineCamp captures the actual movement, and that changes everything about how the problem can be treated. And just as important, this approach is designed to identify the problem without putting additional stress on already injured tissues, so you can move forward with a plan that is both targeted and protective. Now, let me walk you through the 3-step approach that addresses this problem in the correct sequence and that gives patients a real path forward toward recovery. And once this is approached in the right order, the process becomes much more predictable and much less frustrating. Step 1 is to identify the instability before making any treatment decisions at all. Using independent motion analysis testing, the objective measurement of spinal movement at each segment is established first. This process tells the clinician whether there is excessive motion present at any cervical level, which is the measurable clinical indicator of a ligament injury. And it provides the real picture of what is happening inside the spine rather than relying on symptoms or patient description alone. Without this foundational step, every treatment decision that follows is operating on an assumption rather than data. And assumption-based treatment does not produce consistent or reliable outcomes for patients dealing with post-accident and injury ligament instability. Once this step is done correctly, you are no longer guessing. You know exactly what needs to be addressed and what does not. Step 2 is to stop the movements that are continuing to damage the already injured ligaments. Many people are still doing 2 of the most commonly recommended neck stretches without realizing they may be making things worse. This is one of the most important turning points because continuing the wrong movements can quietly prevent healing without you realizing it. The first is forward flexion stretching, which is the movement where you pull your head down toward your chest, like so. The second is backward extension stretching, which is looking up toward the ceiling and pulling your head backward into extension, like so. Both of these movements place significant mechanical stress on the support structures of the neck, and when those structures are already damaged from a car crash injury, these movements increase the existing instability, slow down or prevent tissue healing, and in many cases, actively keep the patient cycling through the same pain over and over. Removing these aggravating movements is not a minor lifestyle adjustment when instability has been identified through objective testing. It is a required clinical step in protecting the injured tissue and creating the conditions in which the cervical spine can actually begin healing. In other words, before you try to fix the problem, you have to stop making it worse.
So why do we want to avoid certain stretches like flexion stretches or extension stretches? Is that typically in a motor vehicle collision, especially a rear end collision, which is the most common, the ligaments in the back of the neck and the front of the neck are the ones that are damaged. And what happens is, just like this good old soda can holder here, is it's known as plastic deformation. So when those ligaments stretch, they don't fully tear, but what they do is they become deformed, weak, stretched out further. They don't fully tear, but they don't go back to normal like the other ones. That's exactly what happens to the ligaments. So we need to add stability there, first and foremost. So when you do further stretch those ligaments that are damaged in the back of the neck or the front of the neck by pulling the head down like so, it's further stretching those ligaments that are already damaged before adding stability. And the same thing if you're looking back up, we're damaging the ligaments at the front of the neck before we add stability. Another common stretch is also looking down and turning like this, which then will really isolate those ligaments in the back of the neck or the facet capsules that are damaged. So if we already have this situation here, we don't want to further stretch those ligaments. We want to try to add stability. Now we can never get it perfectly back to this again, but we need to add the stability first before we go in and try to do any type of stretching.
Step 3 is to restore stability before working on mobility. And this is the core principle that separates patients who recover well from those who remain stuck in prolonged pain cycles. This is where the approach becomes both safer and more effective because the focus shifts to protecting and rebuilding the injured support system instead of stressing it further. The guiding rule is that you do not stretch spinal instability when it is present. You establish stability first, before any flexibility or mobility work is introduced. That means implementing controlled stabilization exercises, following a targeted corrective care plan that is based on objective findings from the motion analysis rather than on generic treatment protocols, and in appropriate clinical cases, providing regenerative support to assist the healing of the damaged support ligaments. Once genuine stability has been restored to the injured segments, it then becomes both safe and effective to begin restoring full range of motion and flexibility through progressive rehabilitation. That specific sequence moving from stability to mobility is not optional. It is the biological order in which these structures heal, and following it correctly is what determines whether a patient achieves full and lasting recovery or continues managing the same symptoms for months or even years. When this sequence is followed correctly, patients are no longer stuck cycling through temporary relief. They begin moving forward toward real, lasting improvement. Here is a demonstration of one of the best spinal stability exercises you can do for the cervical spine, especially when there has been a car crash and potential ligament injury. This actually works what's known as the deep neck flexors, which actually run along the very front of the spine, very deep in the tissues. And I have yet to see in 21 years of practice a patient that has been involved in a car crash that actually has not had an issue with these muscles. And these are key stabilizing muscles of the cervical spine. Now I'm using what's known as a biofeedback device or a pressure stabilizer. These can be regularly found on Amazon. You can also use just a simple rolled up towel on the back there for simplicity's sake at home, as well, just to put in the middle of the neck. You might apply slight downward pressure. In this case, we'd start with 20 millimeters of mercury pressure. We want to just do a slight nod. I'm actually just only tucking my chin towards my chest and holding it. I want to hold that for 10 seconds and relax. I want to perform 10 repetitions of that movement over a 5 to 10 minute period at least 3 times a week. And if you've been in a car crash recently, you should be doing that almost daily. That is a simple stabilization exercise that activates the deep muscles that stabilize the neck. And when performing this exercise, what you do not want to do is incorporate the muscles. You'll see this SCM muscle here. It runs from the back of the skull right on down to the front of the chest. Or you want to be straining the front aspects of the muscles of the neck. You're really just using the deep neck muscles and only doing a slight chin tuck or a nod motion. If stretching has not been giving you the lasting relief you expected after your car accident injury, That is not a sign that your case is hopeless or that surgery is the only answer. It is usually a sign that the problem has been misunderstood, not that it cannot be fixed. When the instability is found through objective testing, when the aggravating movements are removed from the treatment plan, and when a stability-first corrective protocol is implemented based on actual clinical data, your outcomes improve significantly. And once the right problem is identified, the path forward becomes much more clear and much more focused, without the trial and error that keeps so many people stuck. Lasting recovery from a whiplash-type cervical spine injury is achievable, and surgery is not the inevitable outcome for these cases when the right assessment is performed and the right care sequence is followed. At this point, you are no longer just managing symptoms. You're actually addressing the cause and moving toward real recovery. If this information gives you a new perspective on what has been happening with your neck, please like and share this video so that other people dealing with the same problem can find it and access the information. Subscribe to this channel and tap the notification bell because I release weekly videos on spinal health, structural correction, and how to recover properly from injuries without surgery. If your neck still hurts months or years after a car accident, watch this next video. I break down exactly why it may not be healing and what you need to do to fix it.